Madam Speaker, yesterday the First Minister said he would give straight answers to my questions, and I appreciate that. This week I received a letter from nurses at the neonatal intensive care unit at St. Boniface Hospital. Over 70 nurses signed a letter, and frankly it was a cry for help. They are pleading for change for this government to do something about the dangerous levels of overtime that nurses are having to endure. Just as recently as last weekend, nurses are being forced to work 16 hours of overtime and even a shift as long as 20 hours. This government promised to protect frontline workers and the most vulnerable. Intensive care nurses are the front line of the front line, and babies in intensive care are the most vulnerable of the most vulnerable. This has been going on for months, Madam Speaker. Does this Premier seriously believe that of all the places in healthcare to shake up, that newborn intensive care was the place to do it?
The Honourable First Minister.
I thank the frontline workers in healthcare in particular for their understanding and their patience during this period of change. It's not easy, Madam Speaker, and I understand that very well. I also understand that their involvement, their voice is important to this government, and I have had the great chance to be the beneficiary of a lot of input, as have my colleagues from people who work in the front lines of healthcare, and we have listened and we are acting on those concerns. I can also encourage him to visit the New Grace Hospital ER and to see how bigger, better, and faster can work to benefit the clients of our healthcare system, and to see all the intricate design advantages that we've derived in expanding that ER by listening to the frontline workers themselves, not just nurses, but also the healthcare aides and others whose input was vital in making sure that we improve our system, that we shorten wait times, and that we make sure that, as my friends who are nurses have told me, they want to work in a system that works better for patients.
Hear, hear. The Honourable Leader of the Second Opposition on a supplementary question.
Madam Speaker, the Premier and his government can talk about wait times. My question was about St. Boniface and NICU and the nurses there. There is no such thing as a wait time for a mother in labour. What is being asked of nurses is not just unfair and unreasonable, it is dangerous. There are limits on how long truckers can drive without sleep, so they don't kill someone on the highway. We have a situation where nurses who are looking after babies who are the sickest of the sick are being forced to work dangerous hours, 20-hour shifts with 3 or 4 hours of sleep. They are being told that when they need to cope, they should get therapy through the Employee Assistance Plan. The Minister of Health is aware of this issue. The Premier is aware of this issue. Are they willing to accept responsibility if something terrible happens, as the nurses have warned, or are they willing to act now to listen and engage?
The Honourable Minister of Health, Seniors and Active Living.
Thank you, Madam Speaker. The members should know that we've already acted. We're aware of this. There is a 10% increase in volume at St. Boniface in the NICU unit. We're aware of this. I've immediately instructed the WRHA to work with that hospital. They're working collaboratively both with the staff and the union to address the immediate issues. However, I'd also say that since the letter that he's referring to was written, there have been a number of nurses hired. Indeed, 35 new nurses have been added to St. Boniface and 3 or 4 more already into that particular unit. We're aware, we're acting, we care.
The Honourable Leader of the Second Opposition on a final supplementary.
Madam Speaker, I first heard about these issues almost a year ago, in October of last year. So the idea that this is a problem that only came about because there's been a 10% increase over the last year is false, though, or perhaps the Minister has erred. In responses to nurses from St. Boniface Hospital, the response to nurses has been that they're preparing a briefing note and a business plan to try to address the issue. One of the elements of the BITSA bill the government introduced states that all employees in healthcare in Manitoba are now employees of shared services. This government promised to protect the front line, they promised to protect the most vulnerable, and they promised to cut from the top. In the 1990s, the PC government created RHAs, a massive new layer of bureaucracy at arm's length from accountability, in part so they could blame someone else for their cuts and their mistakes. How can this Premier justify the creation of yet another layer of bureaucracy and even greater central planning while cutting frontline care and closing hospitals and departments across the province?
The Honourable Minister of Health, Seniors and Active Living.
So the member's assertion is incorrect, and actually I would want to indicate to him that while there are some pressures faced at St. Boniface NICU because of volume increases which we're addressing, he should know that since January of 2016 in the province of Manitoba, nurse overtime is down 29%. Madam Speaker, our plan is working. In the meantime, there are jobs for nurses, for all nurses who want to work, but I would remind him as well that when it comes to this specific issue, the CEO for St. Boniface clearly says that the shortages that they are experiencing are long-standing and they are addressing them.